All right, we're going to go ahead and get started. Welcome to the Ordering COVID-19 Vaccine and Links training. My name is Brooke Zering, and I'm the COVID-19 training coordinator for the immunizations program. Joining me today is Adrienne Whitney, who is the vaccine distribution and procurement manager, Judy Green, who is the Links operations manager, and David Oliver, who is the Region 7 COVID-19 vaccine specialist. They will be presenting on today's topics. This presentation will be recorded and later posted on the Links website, lalinks.org, under the Links Training Videos button. During this presentation, please type any questions you may have in the chat box. There will be a Q&A session following the training where all questions will be addressed. The learning objectives for today's training is to list steps in ordering COVID-19 vaccine through the Links program, describe the process for determining Moderna and Johnson & Johnson's Janssen vaccine expiration dates, summarize actions needed to change organizations' Links users authorized to place vaccine orders, and lastly, differentiate between vaccine orders shipped directly from the manufacturer and orders delivered by Louisiana's Vaccine Distribution Center, Morrison-Dixon. I will now pass it over to Adrienne, Judy, and David to start the training.
Good afternoon, everyone. I am Adrienne Whitney, and I'm going to discuss with you in the beginning why it is important for you to place your own vaccine order. So one of the main things is now you have the opportunity to place the type of vaccine that you want. So in the beginning, we were kind of giving you on vaccine based upon availability, but now you'll be able to choose which type of vaccine that you want. Currently, we do not have Johnson & Johnson available for you to order because your supply is not sufficient. So the only two choices of vaccine that you're going to currently have is going to be between the Moderna and the Pfizer vaccine. This also gives you the opportunity to order the amount of vaccine that you need. Before, we may have given you 100 doses and you may have not need 100 doses. So now you have the opportunity to place the amount of vaccine that you actually needed when you actually need it. You also have the opportunity to place your order whenever you want. So in other words, the order form, once it goes live, is going to be open 24/7. So you can go ahead and place an order for just in time when you need vaccine. So if you know you're about to have a clinic coming up in the next 3 weeks, you can go ahead and place your supply of vaccine for that at that time. Nothing is really going to change as far as you receiving your vaccine. You're still going to receive it either directly through McKesson or you're going to receive it through Morrison-Dixon. Now we just have the opportunity that you can place that order yourself. Next slide. Ms. Judy.
Am I muted now?
Yeah,
You're
we can hear you.
Okay. Okay. I was double muted. I'm sorry. I was just talking to you. I'm Judy Green, and I'm the operations manager for Links, and we're going to talk today about those that have the opportunity to place the vaccine orders in Links. Not all Links users have permission to place COVID-19 vaccine orders. LDH prefers that ordering vaccine be limited to 2 people per site. By default, when we set up your COVID application, the 2 people that were listed on the application as the primary and the backup vaccine coordinator are the 2 that are set up to place orders and to take care of the inventory in your site. In order to change those people that have the permission, you would need to email to the regional immunization consultant, which is listed on the home page of Links, and request that change, who you want taken off and who you would like to be added. If the person that's added does not have access to links at this time, you would also need to go under the Document Center, download the individual user agreement form, and submit it to your regional immunization program coordinator. Next slide, please. Okay.
Okay, the order form will go live Wednesday, April 14th at 8 a.m. And so that's when you can access the order form to place your order for the vaccine. And again, like I said, the Johnson & Johnson vaccine will not be available. It could be, vaccine could be placed at any time, 24/7, so you don't have to stick to a Friday or a Monday. You can place vaccine at any time. The order form is always open. Also, I wanted to emphasize to you all, when you place your doses now, there's no indication of first doses or second doses. We have enough supply at McKesson, whereas you can place an order as needed. So in other words, if you want to place your order for your first doses, you can, and then 2 to 3 weeks later, you'll go ahead and place your order for those second doses. You don't have to place your doses all at once for first doses and second doses. And like I said, there's no differentiation between it. I know Morrison-Dixon did that in the past, but that's not something that McKesson does when it comes to processing your orders for your vaccine. You're just going to get it at one time, and you're going to have to differentiate whether, say for instance, if you place an order for, and I'm going to just give a number, for 20 first doses, then you know 2 to 3 weeks later, hey, I can place another order for 20 doses to cover those second doses. But there are instances where you may not have used all those 20 doses, and you can actually use those as second doses. So technically, you do not have to place another order. Next slide. It didn't advance, Brooke. Well, I'll go ahead and just talk. So now I'm going to talk about how much in the quantity amount of the vaccine that you're going to order. So for right now, in the beginning, it kicked out.
Adrian, we can still hear you.
Okay, all right, my screen went blank. I'm sorry. Okay.
Do you see anything?
No, I don't see anything.
Judy, do you see anything?
We can see how much. I mean, we can see that. You want me to bring the laptop over here?
No, I have it. I could go. So now I'm going to talk about how you can place your order. So for right now, for Johnson & Johnson and for Moderna, you can place a minimum amount of 10 doses, and that's going to come directly from Morrison-Dixon. If you place an order for a minimum of 100 doses, that's going to come directly from McKesson. I prefer if you place your order in increments of 100, that way it makes it easier. So say for instance, if you place an order for 120 doses, we're gonna round it down. Or if you place an order for 170 doses, we're gonna round it up just to make the shipping process easier. So if we do approve,
Adrian, you were just muted.
okay, you can place those doses for the additional 30 doses if you need be. Because like I said, now we're at a point everyone is not utilizing all of their first doses at the same time. So please be advised when it comes to the Pfizer vaccine, you can place an order in increments of 6 doses for the Pfizer vaccine. And of course, Pfizer is only going to direct ship multiples of 1170 that you're going to receive directly from Pfizer. Everything is still going to remain the same as far as you receiving emails. You're still going to receive your emails about shipments coming from Pfizer and those that's coming from McKesson, and Morrison-Dixon is still going to call you to verify that you're ready to receive your vaccine, even if you placed your order. Also, just to let you know, in the process of us looking at your order, we do get to see what your current inventory is, and we can see the utilization of the vaccine that you have done in the previous month and the previous 3 months. So if we feel that you have more than enough vaccine in your inventory, we can deny doses or we will deny the order. So what we tell providers to do is to periodically go back and check links to see what the status of your order is. So right now it's going to take us 1 to 2 days to process the actual approval of the order. And then after that, it's going to take 3 to 5 days for you actually to receive your vaccine physically in your presence. Next slide.
Okay, for the next topic, we're going to talk to you about how you get the vaccine expiration date for your COVID vaccines. Your Pfizer vaccine will come with the expiration date on the box and on your order form, but the Moderna and the Johnson & Johnson vaccine, you will have to look up the expiration date before you put the vaccine into your inventory. For the, may I share my screen now so I can kind of give them a demonstration of this, please? Thank you. You can see my screen now.
You can see it.
For the Johnson & Johnson vaccine, you will go to their website, which is listed on the slide, and you will have a copy of it. You go to their website, and it has a place for you to enter the lot number that you receive. We're going to enter a lot number 1709882. We're going to check the lot. And it's telling me that lot number does not exist. Okay, that doesn't sound too good, does it? Okay, let's try another one. We'll check this lot. Okay, and then it will show you the lot number 1808982. The expiration date is June 23rd, 2021. Johnson & Johnson will not come to you with an expiration date on the box. The Moderna vaccine will come to you, and it will most likely have an expiration date of something in the neighborhood of 2069. So what you will have to do with that vaccine, before you put it in your Lynx inventory, you will need to go to the Moderna website, and it's the same process. You will enter the lot number, which we're going to enter 004M20A, and we're going to submit it. And it's going to tell us that the expiration date for that vaccine is July the 10th, 2021. So anytime you get an order of Johnson & Johnson or Moderna vaccine, you must go to their website and get the expiration date before entering that vaccine into the Lynx system. Okay, next slide, please. Okay, how we order and place vaccine orders in Lynx. We're going to go over with you now how you reconcile your inventory, how you place a vaccine order, your incoming and outgoing vaccine transfers, and special situations that might occur. Okay, as you see now, I have logged into Lynx with my login, and I am an organization that, you don't see my screen? I'm sorry. I do that every time. Now?
Yep, we can see it.
We see it now?
Yeah, it's there.
Okay, thanks. Okay, I've logged into Lynx under my COVID test site, and I'm an organizational user. You'll either be a facility client user or an organizational user. A facility client user is where you have access to only one facility under your organization, and your organization may only have one facility. But if you have, let's say, a group of drug pharmacies that are all under the same organization, you may have access to all of those facilities under that one organization. In that case, when you log in, it will immediately tell you you must also select your facility, because your ordering is always done through your facility and not your organization. So in this case, I have 2 facilities, so I'm going to choose the facility I'm going to be placing an order for today. And once I get into my facility, I'm going to go over first to my orders and transfers menu item. I'm going to say create and view an order. Down here, I'm going to say I want to create an order. In order to create an order in Links, you must first reconcile your inventory that you currently have, and it will come up on your screen at that time. And until you reconcile your inventory and submit your inventory, it will not allow you to go to the order screen. So in this case, I have 2 lot numbers of COVID vaccine in my inventory. Now, if you are a VFC provider, you're going to see all of your vaccines that are in your facility listed under this. All of them will have to be reconciled before you can place an order, even for COVID vaccine. So your reconciliation has to be done for all of your vaccines. Now, in the event that I have 2 lot numbers here, and if I actually have the 10 doses of this one and the 18 doses when I go to my refrigerator or freezer and look, then all I need to do is say on there, this is exactly what I have, and submit it. But let's say in the event that this vaccine right here is a Moderna vaccine, and let's say I only got 9 doses of vaccine out of this vial instead of 10. So actually right now, I only have 9 doses in my inventory, or I wasted a dose, or something happened to one of the doses. So I enter in what I actually have in my inventory, and then I have to select a category and a reason for making an adjustment to this vaccine. In this case, if I could only get 9 doses out of a vial, I'm going to choose the wasted category. And when I go to the reason, I'm going to choose dose variance. That means that I only got 9 doses instead of 10 out of that. Had I dropped it, spilled it, broke it, if I had drawn it up, not used it, if I just lost it, it was unaccounted for, or if it was damaged in transit, I would select one of those. If the vaccine was actually administered, but I don't know what happened to it, it's just not showing in my inventory, but I know it was administered, then I'm going to select that category. And my reason is going to be either administered, not linked to a vaccine, or administered to a client who chose not to be in the registry. In the state of Louisiana, we are an opt-out state. Therefore, anybody that receives a vaccine in the state of Louisiana from birth to death is to be recorded in the Links registry. In order for someone to opt out, they must complete a form, submit it to our office in New Orleans, and we take care of that opt-out situation. So you would never want to choose this reason, because the first thing you're going to do is get a call from your immunization program consultant wanting you to explain this. If you select administer but not linked to a vaccine, the same thing's going to happen, because they're going to want to know, did you not get a patient put in the system? Why are you saying that you administered this vaccine, but we can't find where it was come out of your inventory? Some cases of that is if you have electronic submissions to the system and something doesn't come over correctly, or the message errors out, it may mean that that patient didn't come over and your inventory didn't get decremented. But we have to find and we have to account for every dose that is sent to your office. So in this case, we're going to say that we actually, and of course you have the expired button that the vaccine expired. So we're actually going to waste this dose and say it was a dose variant. Now, once we have our inventory ready, we're going to submit our inventory. And then our order page is going to come up. If you only have COVID vaccine in your facility, then your vaccine order set COVID will automatically come up. But in this case, I also have VFC vaccine possibly. So I have multiple order sets. So I'm going to click here and I'm going to select my COVID-19 distributor order set. Once I do, it's going to bring up my order blank. And as you can see, I have all three types. Now, if there's no one type is not available, which I think the Johnson & Johnson will not be at this time, then you will not see this one available on your order blank. You will only see the Pfizer and the Moderna. Now we're going to order, today we're going to order 100 doses of the Moderna vaccine. And for some reason, I'm not getting my vaccine. Do you have me, our vaccines active, our order forms active, Adrian?
Hold up, I'm double checking.
Okay.
All right. You can do a refresh your screen. I'm sorry about that.
Okay, that's fine.
Oh, and you can place an order for smaller amounts. I did adjust that.
Okay, great. All right. Okay. So in this case, we're going to order 100 doses of the Moderna vaccine. So we go into the vaccine name and we choose our COVID-19 Moderna, and we're going to order 100 doses. That's all we have to do. The only reason that we would possibly put a comment in there is if maybe we were planning a big clinic that we're going to need more vaccine than we would normally use, and you might want to put a comment in there to that, so that when the vaccine order gets to Adrian and her group to approve, that they will see the comment you made and know why you're ordering as much vaccine as you did. Please note on here, as Adrian had said to you, it's going to show you how much vaccine you currently have in your inventory, and it's going to show you how many doses were used in the last month. Once I say I want 100 doses of Moderna vaccine, I'm simply going to submit my order. And as you can see now, it shows me that I've successfully created an order. And as you see, it is pending state approval. It's in my inbound orders that I just placed.
You can check it, Judy.
Okay. Now, my vaccine has come in. I've got it sitting in front of me. The first thing I'm going to do, because I ordered Moderna vaccine, is I'm going to the Moderna website, and I entered my lot number, 004M208. That's what I'm getting today. And it shows my expiration date is 7/10/21. Once I do that, I'm going back to links. I'm going to log in. I'm going to orders and transfers, create and view orders. And it's now going to show that my order is sitting there inbound and it has been approved and it's ready for me to accept it. So I'm going to select the order. When I do, I'm going to say that I actually received 100 doses. My manufacturer is Moderna. My lot number is 004M208, and my expiration date is 7/10/21. All I have to do then is receive my order. Once I receive my order, I'm going back over to my menu where it says lot numbers. I'm going to hit reconciliation. And as you can see now, I have that 100 doses of Moderna vaccine is in my inventory ready for me to use. Okay. Now, there's sometimes, now and then there's special circumstances. It does not happen very often, but sometimes you will place an order, and I'm going to go ahead and create another order. And this time I'm going to create an order of Moderna vaccine again. Or better yet, I'm going to create an order of Johnson & Johnson vaccine. And as you see, it takes me straight to the order form now because I'm placing this order the same day. So in the event that you would have to order, you needed 120 doses of vaccine, In order to do that, you're going to have to place an order for 100 doses of vaccine, and then you're going to turn right back around and you're going to place another order for 20 doses, because that means that's telling Miss Adrian that you actually need that 120 doses. So she's going to place the 100 doses will be coming from McKesson. However, the other 20 doses will be coming to you from Morrison-Dixon. So in a lot of times, this may be the case where you'll get two different lot numbers. But today we're just going to, and you won't have to reconcile your inventory if you replace that same order. You only have to reconcile it if you've not placed an order within 24 hours. So I'm going back to my COVID order set again. I'm going to again order, this time I'm going to order some Johnson & Johnson vaccine, and I'm going to order 200 doses, and I'm going to submit my order. Okay, once I submit it, you see I have it pending state approval here.
It's finished.
Okay, so I get my vaccine in. The first thing I'm going to do is I'm going to the Johnson & Johnson website. And when I get my vaccine order in, I notice I have two different lot numbers. So I have two different lot numbers that I'm going to have to look up on the Johnson & Johnson website to get the expiration date. So I'm going to enter the first lot number, check the lot number, get the expiration date. I'm going to enter the second lot number. I'm going to check the lot number. I'm going to get the expiration date. Once I do that and have the expiration date for each lot number, then I'm going back to links. I'm going back to create and view orders again. And here I have my order approved. So I'm going to select my order. And it's going to show 200 doses of shipped quantity, but I got 100 doses of two different lot numbers. So I have to enter these as such. So what I'm going to do is I'm going to enter 100 doses of the one that I got of lot number 101808982. The expiration date for that one was 06/23/21. Then I'm going to say I'm going to receive that 100 doses. And it's going to pop me up a screen and tell me basically that what I'm receiving and rejecting are not equaling to what was shipped to me. And so then it's going to tell me if I continue, the items not received will remain on my order form as requiring receipt. So I'm going to say, yes, I want to receive that 100 doses. And what it's going to do is simply going to add me another line and show I still have 100 doses I've not received. So I'm going to enter in this 100 doses of this Janssen with this lot number and this expiration date. And then I'm going to receive it. Yeah, I should have had my, okay. Then I want to go to my reconciliation page. And you're going to see my 100 doses of this lot number and my 100 doses of this lot number. So I have it all in my inventory. Now, the next thing I want to do is my other test site needs some vaccine, and they forgot to order vaccine. So they need me to transfer them some vaccine from my inventory to their inventory. So I'm going to go into my orders and transfers. I create and view orders. And you may be doing this from one of your facilities to another, or one of your pharmacies to another that's in your chain or something. So when I get here, I'm going to create a transfer. And I'm going to have to select my organization. So it's going to be my COVID test site organization. But I want to send it to my facility COVID site 2. And I'm going to send them 50 doses of this vaccine of my Johnson & Johnson. So I'm going to say 50 doses. I can put a reason in here, or I can just simply say COVID vaccine. Once I do that, I'm going to create the transfer. And as you see here, I have an outbound transfer that's being sent to my other facility, and it's been approved. So all I have to do in that point in time, I'm going to log into my other facility now. I'm going to create and view orders under my COVID site 2. And as you see, I have an inbound transfer right here from my COVID test site. So all I have to do is select that inbound transfer, and everything's going to be there for me. So all I have to do is simply put the 50 doses in here. It already has the lot number, the expiration date, everything about it, and receive the vaccine, and it will come into my inventory. Okay. So then I'm going to my lot numbers reconciliation. And you can see it's in my inventory ready to go. Now, one other instance that may happen is I'm going back to my COVID test site facility now, because I have more vaccine in it in my inventory than this one does. And I'm going to make another transfer to my site 2, because they called me and they said, no, they really needed more vaccine than that. So I'm going back into create and view orders, create a transfer. And they told me they needed some Moderna vaccine in their inventory. So I'm going to go here, and I'm going to send them 50 doses of this Moderna vaccine. You always have to put a reason. I'm going to create this transfer. Well, I guess if I send it right, I will. And anytime you don't do something right, I can tell you it's going to tell you. I forgot to select where I was going to send it to. Okay, let's try this again. Now I'll create the transfer. So you see I have an outbound transfer going to COVID site test, and it's been approved. So they're supposed to come over to my site and pick that vaccine up. And so then I get a phone call about an hour later, and they said, oh, they made a mistake. They decided they didn't need that vaccine after all. So they don't want to come pick that vaccine up. It's already over there in their transfer, and it's already been approved. but I don't want them to reject that transfer, because if they simply reject that transfer, it's going to remain in my inventory. So what I'm going to do is I'm going to come into where I place that transfer. I'm simply going to select that outbound transfer that I was going to send to them, and they decided they didn't need it. And I'm going to delete that transfer. That leaves that vaccine in my inventory, and it takes away that transfer that's inbound and sitting in their inventory. One more thing we'll do is if we go in and we're going to reconcile our inventory, because we have let some vaccine waste. So we're going to say right here that this 9 doses of vaccine right here, we've wasted it. It was left out and it wasn't used, or the cold chain had expired, but anyway, we wasted that vaccine. So we're going to come here and we're going to put 0 in there because we don't have any left of it. We're going to select the wasted, and we're going to say that it was drawn up and not used. We're going to submit this to the state. Now this is 9 doses of the vaccine. I'm going to submit my inventory. Now I have to ship this vaccine back to New Orleans. Before I ship this vaccine back to New Orleans, I must create a transfer sheet transferring this wasted vaccine from my inventory. I did. Please provide a row 1. Oh gosh. Oh, I know what I did. I submitted instead of submitting that, you would just want to save it. Because if you submit it, you have to put something in each line. Whereas I'm just taking this one out, so you can just simply save it. Sorry, I failed to mention that. Okay. Now I'm going over in links, and I'm going under the reports module, and I'm going to state reports. And under state reports, we have a vaccine transfer report. I'm going to click on this. I'm going to say that this vaccine was transferred to New Orleans. Office. It was damaged. The vaccine type was COVID. The number of doses was 9. The lot number was 005 M20A. The expiration date was 08/31/21. Vaccine left out of refrigerator for whatever reason. I have to put my COVID PIN number in here, or my PIN number, if it's a VFC, whatever type PIN number it is. My clinic name, to the date I'm making the transfer. And then I'm going to print this form out on my printer. And once I do, I'm going to sign it, and I'm going to put it in the envelope, the package, the box, whatever I'm sending it back to New Orleans. And here's the address, et cetera, that it's to be sent to. Okay. At this time, I guess I could ask for questions.
We have a few questions in the chat box. The first one, do you have any idea how links will perform with a lot of simultaneous users entering orders on Wednesday when ordering opens?
This will not be a problem at all. We deal with this every season with flu vaccine, so the system can handle it.
Next question. Is there any way links can eliminate the VFC eligibility status update page? That page takes forever to load, and I don't think it pertains to us. We can link it. Let's see, it moved up, sorry. We can link all of our shots for the day in a fraction of the time it takes if we didn't have to wait for that page to load.
This is Quan. We're working with our vendor to see if we can increase that thing. It's unfortunately right now it's either all or none. So we're working to remedy that situation right now. But as far as requiring it, it's part of the process that we go through.
All right, the next question. What do we put for the VFC eligibility question for younger patients?
I'm sorry, say that again, please.
What do we put for the VFC eligibility question for younger patients?
Well, you put the same that you would put if you're given VFC vaccine. Is that not correct, Quan?
Yeah,
Or do they put
correct.
not eligible?
Right, that is correct.
Yeah. It's treated just like, it's a public vaccine, so it'd be treated just like a VFC vaccine. If the patient is VFC eligible, you would choose Medicare, Medicaid. I don't think they'd be eligible for Medicare, but Medicaid or no insurance or either not eligible.
All right, the next question. Must we return every wasted dose to New Orleans?
At this time, that is our process for utilizing wasted or expired vaccine. You're to ship it back to New Orleans with that transfer sheet that Ms. Judy showed you. But at this time, you don't have to use like FedEx or UPS or anything like that. You can use snail mail. That's perfectly fine, and it does not have to be refrigerated. If you want to put it in a manila envelope, that's perfectly fine.
Will it be okay for a pharmacy to only use a partial amount of vaccine received within 7 days? For example, receive 100 doses and take up to 2 weeks to administer that supply.
That is perfectly fine. And as a possibility, you may even, if it extends beyond the 2 weeks, you may actually end up using those doses as first and second doses, and that's perfectly fine.
If I need a certain amount of second doses, how far in advance should I place my order?
I suggest you place it at least 2 or 3 weeks in advance so you can go make sure you have your supply in hand before you schedule. But since you've already scheduled.
If the
2
wasted
weeks should be
dose,
good. I'm sorry, Brooke.
no, it's okay. The next question is, if the wasted dose is already in a syringe, how should it be shipped?
It is not to be shipped back to New Orleans. If you have already drawn up any vaccine in a syringe, please discard of it the way you discard of your other biologicals. Also, do not send us any broken vials or anything like that. Dispose of that yourself.
And document that in links also.
That's it for questions in the chat box. If anyone else has any other questions, feel free to mute yourself or type it up in the chat box.
This is Quan with the immunization program. I just want to remind you guys that the focus that we have right now is that we want to get the vaccine in the arms of the patient or the consumer. So please don't hesitate to quote unquote puncture the vial to give the vaccine. We're still concerned about wastage, but we're more concerned about getting the vaccine out there to the arms.
So I just want to make sure that I understand correctly. If someone walks in and wants a vaccine and we don't have 10 people scheduled and they would be the only person to get that vaccine, you're wanting us to waste 9 doses if we need to?
And that's the key word right there. If you need to, so if you if one person come, in that scenario, we would hope that there's 9 more within that 5-hour time period. Is it 5 or 6, Adrian? If it's room temperature?
It depends upon the vaccine.
Okay, so whatever the time frame is, we will hope to do that. But yes, to answer your question, if it needs to, we don't want to see it that way, but we rather have people vaccinated than concerned about wastage. I mean, we don't want to waste it, but we want people to have vaccine in their arm.
I
We
just
don't
want to
want
make
you to
sure, because
turn it and run away.
at this point, we don't have a wait list, and we are, our patient base has gotten their immunizations already. So it's
Right.
just really random patients that come in, and we don't have a lot of walk-in non-customers. We've been putting a sign by the road and trying to do everything we can, but I don't foresee if I puncture a vial for one patient, I don't see more than 2 people getting it if I don't have shots already lined up.
We completely understand that, and we're expecting to see that to a degree. But yes, we're focused on getting the patient vaccinated.
There's another question in the chat box. For a vaccine in a syringe that is to be wasted, do we still need to complete the transfer report if we're not mailing the vial back?
No, you don't.
Next question. Do we have to order second doses through links now for the first doses that were already given, or will it be shipped as
You
before?
have to place your own order. So you'll place, if you've already received first doses and you know your second doses are coming up, you have to place your order for those second doses.
That's it for questions in the chat box. Anyone else is welcome to unmute if you have any questions. If not, we'll move on. I'll give it a few minutes.
I have a question. Can you hear me?
Yes, we can.
All right. We actually received 100 doses from the National Guard, and I haven't seen them in links. I was assuming that they would put that in, and then when I got them, I could receive them. So I'm not sure how I'm supposed to put the order from the National Guard to recognize that we received them and have started giving them.
Okay, have you already received the vaccine and started administering it?
Yes.
Okay. Where is your clinic located?
We're in Covington.
Oh, okay. I'm gonna have, better yet, I'm not. Let's, if you'll put my email address in the chat, if you don't mind, Brooke, and if you will send me an email with your contact information right after this call, I will get in touch with you so we can get that inventory, because we need to get it into your inventory because it needs to be decremented.
Yes. Okay. I missed that email. Judy Green.
Judy.green@la.gov.
It's in the chat.
All
box.
right.
It's in the chat box. Yeah.
I'm on my phone. It flashed for a second.
Oh,
Okay.
okay, that's fine. It's judi.greene@la.gov.
Perfect. Thank you.
Okay.
All right, we'll continue on with the presentation. So Judy, that's you.
Okay. We're going to talk about some resources for further study at this time. We have a new LDH Links training learning management system. We have Links training videos that are on YouTube. We have the vaccine transfer quick reference guides. We have, if you have any link system questions, you would need to email them to la.links@la.gov. We have a help desk. All of this is on the front page, on the home page of Links. You can call or email your regional vaccine coordinator. It's also located on the home page of Links. Any immunization program questions, you can email la.immunizations@la.gov. And at this time, I'm going to, Brooke, I want to turn it over to David Oliver, and he's going to go over the learning management system.
Okay, David, if you want to share your screen.
David, are you on?
I'm sorry, what y'all needed me to do? I apologize.
Now, David was on. I don't know what happened to him. Okay, I don't see him. He seems to have disappeared. So I will share my screen and kind of go over it.
Yeah, he was on.
Can you hear me now?
Oh, there
Yes.
you are. Okay.
Yes.
Yeah.
Good afternoon. My name is David Oliver. I am the COVID-19 specialist for Northwest Louisiana Region 7. I'm wanting to just take you through the LMS site. You can reach this by going into links homepage itself.
David, can
I
you
will
share
show
your
my-
screen?
I am. Can you see my screen?
Now we can, yes.
If you go into links, you're only, when you log in to the home page, if you come to the document center and open it up, in the links enrollment documents, it's the very last one. It says LA Links LMS account tutorial. You will download it. Then it brings the process of how to create an account. It is a very simple process, and I highly recommend and strongly urge you for all coordinators or anyone that would be doing any data input into links, they need to go through these courses. These courses are designed to not only just show you how to do it, but it's also going to make sure that you comprehend what you're doing. But like I say, this here, it's a very simple process to go through. You create your account. When you go into LA, if you don't want to go in through the web page, it's lalinks.lsu.edu. You will then go in and you'll start to create your account. It's going to come up, you have to create a username and a password. Once you've done that, then it's going to ask for some more pertinent information, like what is your organization, where is your facility located, and what parish you're in. Once you have done that, it will then tell you to continue. And this is now creating your link. Once you have created the link, then it will take you into the courses. The course it will show is using links to administer COVID-19 vaccines. There are 13 modules in this. There are 13 videos and there are 13 tests. This here is an example of the very first one, your personal settings. It will show the video, then you will have the questions afterwards. Once you have completed watching the video, this is very important, you must check the box in the right-hand corner above the video. This is to show that you have completed that video. Then you can attempt the quiz itself by just clicking on it, and then it will take you through the process. If you do not get all questions correct, then it will have you to attempt the test again. And this will continue until you get them all correct. At the end of this, if your organization requires, has training records for its employees, you will be able to print a certificate that they can put into their training record to show that they have completed links training. I would highly recommend that you also take that certificate and put it in their records. This is a very good course. I've gone through it myself personally. It covers all the very important factors in links, which we tend to have problems with: transferring vaccines, orders, reconciliation, adding patients, putting vaccination in patient records. Like I say, if you follow these processes in these videos, you will not have any problems. Are there any questions?
There are none in the chat box.
Thank you, David. That
Yes,
was-
ma'am.
Adrian, Judy, or Quan, do you have anything else to add before we finish up?
I don't have anything else to add. Thank you.
I don't have anything else.
Ruth, if you want to take over.
Good afternoon. On behalf of LIPA, the Louisiana Independent Pharmacies Association, I wanted to express our gratitude to the immunization program folks for collaborating with us to be able to offer CPE credit, immunization-based 1 hour of credit. To claim your credit, the code is 412. To remember it, it's the date, 412, 412. And just go into Lecture Panda, complete the evaluation, and your will be automatically uploaded to CPE Monitor. And if you have any problems or questions, you can email me or call me at those numbers. Thank you.
Thank you all for attending today's training. In case you missed anything or need clarification, we will have another Lunch with Links training on ordering and reconciling tomorrow at 12 p.m. You can find all upcoming trainings on the provider webpage on the LDH website. I also included it in the chat box. And there will also be another COVID-19 vaccine storage and handling training this week at 11 a.m. on Thursday, April 15th, which can also be found on that webpage. For any links questions, please email la.links@la.gov. Thank you all.
Thank you.